Good morning and happy Monday. Let's talk about what happened in healthcare last week. All right, story number one. United Healthcare made seniors look sicker than they were for 10 years. We got another lawsuit going on. Massachusetts just sued United Healthcare for $100 million in alleged Medicaid fraud. Here's what happened. United Healthcare is accused of making older members appear sicker or more impaired than they actually were. This was in order to get higher capitation payments from the state. The suit alleges they classified members at a level reserved for behavioral health and substance use disorders, despite those members having no corresponding diagnosis or treatment. Higher risk score, higher monthly payment, no actual care required. This went on from January 2015 to December 2025. And the pressure to inflate revenue got so bad, the company's top Massachusetts executive quit. Massachusetts wants the $100 million back. And under the False Claims Act, that triples to $300 million. Remember, under the False Claims Act, all of those litigations get trebled, which means they are tripled. United Healthcare says the lawsuit is simply wrong. They always do. All right, and our second story today, prior authorization denials. The numbers are, if you can believe it, getting worse. A new Commonwealth Fund survey dropped just last week. 1 in 5 adults with private insurance said they or a family member had a medical service denied in the past year, even though it was recommended by their physician. Of the people who got denied, 63% said it caused significant worry or anxiety. And then 41% said it led to actual delays in care. And then on the Medicare Advantage side, insurers made nearly 53 million prior authorization determinations in 2024. 7.7% were denied, up from 6.4% the year before. But only 11.5% of those denials were ever appealed, which is crazy because when people did appeal, more than 80% got their decisions overturned. 80% of appeal denials get reversed, which means the denial wasn't about clinical appropriateness at all. It was about whether you'd fight back. And most people don't. And that's the business model. All right, that's all I got. See you next week.